They have been the ABCs of CPR for 4 decades. Check the airway, do rescue breaths, and then chest compressions. But the American Heart Association is changing that now. It's taking the focus away from breathing and telling rescuers to do chest compressions first to keep the blood pumping and then switch to breathing. CPR courses taught by the American Heart Association instructors will address the new guidelines immediately.
John Schurpa is Director of Education Center with Life EMS Ambulance and is a CPR instructor. Joins us now here in studio to talk more about that. It has been a long time with those initial steps in CPR, and now it's changing. Tell us a little bit more about the changes and why.
The greatest impact that we're seeing is just with the science that's come out is supporting the most important and fundamental skills of CPR is just that, is doing those compressions, circulating that blood around, and increasing the survivability of our patients in the long term. So it's just better patient care for everybody.
Is it just having to do with the sort of studies that show that's what works best at this point? How many years has it been that we've been doing it the other way?
Well, CPR is celebrating its 50th anniversary now. So for 50 some odd years we've been saying airway, breathing, circulation, and we're still saying airway and breathing is still a component of CPR. We aren't completely dismissing that,
right.
But we're putting just the greater emphasis on those compressions and circulating that blood.
Let's talk a little more about getting oxygen to the brain. What are the findings showing as far as how important that is in saving someone's life?
It's absolutely fundamental. It's going to make the difference between life and death. When we're looking at the survivability of our patients, the precious seconds that we spend in what we used to do in assessing airway and breathing, we're finding that if we're on the chest and compressing just that much sooner, we're circulating more of that oxygen-rich blood, improving the survivability, improving hopefully their outcomes, even with their brain functions.
Okay, in talking about it, tell me about the changes exactly. Okay, what is it that somebody needs to do?
The greatest impact in the change is that when you find somebody that is not responsive, is to begin with compressions right away. So
how many times? And then
30 compressions.
Okay.
Then you complete the 30 compressions. If you have training in CPR, do 2 ventilations. If you're a lay rescuer without any training, we encourage you to go ahead and do what we call compression only or hands only CPR, where you just continue on the chest for as long as you can.
Okay, 30 compressions you're saying, and then what? How many breaths?
2 ventilations, 2 breaths.
Okay.
Yeah.
Now tell me more about what if somebody wants to get involved with getting proper formal training on how to get CPR? What is it that you can do? And who do you recommend get it?
Well, they certainly, as far as recommending who gets it, anybody that has any chance of, whether it's in church or they just feel an inkling that they want to know how to help somebody, anyone can do the training. It doesn't age, gender, doesn't matter. We at Life EMS Ambulance offer training on a monthly basis at our office here in Grand Rapids. We do it the first Tuesday of every month. They can find out more details on that on our website at lifeems.com.
It's regularly scheduled. We also have a video that shows you how to do that new CPR technique. That is a link on our website at woodtv.com. Thank you so much for joining us, John Schurpa. We appreciate it.
Thank you for having me.
Brian?